Hey everybody, we're going to talk about blood clotting in this video. Blood clotting is known as hemostasis, literally blood standing still. We're not going to take blood clotting or hemostasis into that much detail. We're going to look at it superficially. First, we're going to discuss 3 steps. The first step is called vascular spasms, followed by a platelet plug formation, and the final step is called coagulation. So let's say that you got a paper cut, and a paper cut can be pretty painful, right? And of course, if you cut into the dermis of the skin where blood vessels are located, you may experience bleeding. So one of the first things to happen when you cut a vessel is a vascular spasm may take place. The smooth muscle lining the walls of those vessels will constrict. Through vasoconstriction, this helps to reduce blood loss. So you can see in this image, the vessel's constriction prevents blood from escaping out through that opening or hole. So if you apply pressure to a cut, that is one way to mimic vascular spasms. The next step is called a platelet plug formation. During the platelet plug formation, blood cells release serotonin, such as platelets, and that serotonin is a chemical messenger that calls for more platelets to arrive at the site of the damaged vessel. You can see in this picture the little tiny platelets shown here are starting to cling to the wall of the damaged vessel. Normally, platelets do not stick to a vessel's interior, or at least that's how it should be. So serotonin calls for more and more platelets to arrive at this scene. This is a portion of a positive feedback mechanism that helps to maintain the closure of this damaged hole here. Okay, so serotonin allows for more and more platelets to arrive to encourage this blood clotting process to take place. Now, if you take an aspirin, for instance, that inhibits platelets from sticking to that area and prevents this platelet plug from being formed. If you've ever had a paper cut or maybe a shaving cut or a small nick in your skin, you may have taken a piece of toilet paper or tissue and stuck it to that site to stem the bleeding. After several minutes, if you walked around the house and forgotten that you had this piece of tissue stuck to you, you may realize, oh, time to take this off and remove it. At that point, if you take the platelet plug with the tissue, you may restart bleeding once again. So those platelets can stick to things like tissues. They are not, however, supposed to stick to bandages. All right, so the final process of hemostasis is called coagulation. This is a very complex process, and we are not going to cover all of the various factors 1 through 10 that must interact in order to produce a coagulated piece of blood at that damaged vessel. I will tell you this, that prothrombin is allowed to clot a blood, and that forms what we call a thrombus. Thrombus is just another word there for a clot. Thrombin is also involved. It allows for the conversion of fibrinogen to fibrin. You may have heard of fibrinogen before. We previously talked about it being a plasma protein. Now, it is in a dissolved state in the bloodstream and only appears out as strands or fibers known as fibrin when we need it to clot blood. So that's why when you have blood pulled out of your bloodstream, you know, for whatever you're having done, tests or donations, we want to make sure that that conversion process from fibrinogen to fibrin doesn't take place. If it does, then the blood has now coagulated. So the goal of this coagulation process is to transform blood from a liquid state to a gel-like state at the site of the damaged vessel. Eventually, this clot will transform from a gel-like clot to a solid scab. And that scab will eventually fall off when that damaged area heals. In this picture, you can see those fibers of fibrin. Great name, right? Fibrin is made up of fibers, and it forms this net here that captures blood cells and keeps them from escaping through that wound. So sometimes red blood cells will be trapped in that fibrin mesh, and that's of course why the clot does appear red. So that fibrin mesh is kind of like a fishing net or a volleyball net. It is meant to capture cells and prevent them from escaping through that wound. Another great view of this fibrin network of fibers. You'll notice a red blood cell trapped in there right here in the middle. These fibers are meant to keep and prevent blood from traveling further. It also promotes the coagulation process. Great picture here. This is a good time for me to remind you that coagulation and agglutination are two totally separate and different processes. It is easy to confuse those two terms together, but I caution you to make sure to think clearly before you use the wrong word. Coagulation is the formation of a clot during blood clotting, while agglutination is the process that occurs when foreign blood types have been given during a transfusion. Two totally different terms there, coagulation and agglutination. You may want to copy this link and take a look at it. It's a great video on blood clotting. Let's talk about some needs for blood clotting. In order for blood to clot properly, we need vitamin K, which is found in green leafy vegetables, and we need calcium. We know that calcium is regulated by a couple of hormones, calcitonin for one, PTH is another, and we've also talked about calcitriol back in Bio 210. By the way, these are blanks on your worksheet, so you'll want to take a moment to fill in this information on page 28. Just want to take a side note here and mention to you that blood serum is basically blood minus the cells and fibrinogen. Obviously, if we just need the blood serum, we are looking for blood plasma. That includes water, hormones, plasma proteins, and other items. Why do you think it's important that fibrinogen is removed from blood serum? Well, if fibrinogen is left to sit, it can convert into fibrin, and now all of a sudden you have a bag of clotted blood, and unfortunately that does no one any good. So we don't want to have fibrinogen do that conversion to fibrin. That's why it's removed from blood serum. So fibrinolysis is necessary in order to remove a clot after the scab is healed and after the vessel has been knitted back together. You'll notice that fibrinolysis has two words here, fibrin and lysis. That means we're going to break down fibrin. So if you think about a vessel for just a moment, let's say that this is where your clot formed inside your vessel. If we leave this clot sitting there, which has this network of fibrin all over it, right? Then that can impede the flow of red blood cells through this vessel. And we must remove this clot because it not only impedes the flow of blood and blood cells through the vessel, but it can also break free and float itself. Sitting here against the wall of the vessel, it's known as a thrombus, but if it breaks free and starts to flow in the bloodstream, it then is known as an embolus or an embolism. Embolisms can cause heart attacks, they can cause pulmonary embolisms in the lungs, they can travel to the brain and cause a stroke. So it is critical that our bodies properly perform fibrinolysis to prevent either thrombi or emboli from forming. All right, so on your worksheet, be sure to jot down that a thrombus is a stationary clot and an embolus or embolism is a moving clot. Question there also asks you, how are thrombuses and emboli related? Well, if fibrinolysis fails, you're going to have one or the other, right? If you don't perform fibrinolysis properly, the thrombus may persist inside the vessel. The embolism, of course, is a clot that is now broken free and can cause damage to other organs. I'm sure you've heard of blood thinners. That's just another name for anticoagulants. Anticoagulant means that we are against coagulation or clot formation. Sometimes this is very necessary for people who have heart problems. Heart problems can result in clots that can be thrown to the rest of the body, including the brain. So with anticoagulants, we are looking for a way to somehow impair that third step, that coagulation step of blood clotting. Your white blood cells do produce heparin, which is a natural anticoagulant, and we can also provide medications that do impair some part of that process. We have all sorts of drugs out there called aspirin, heparin, warfarin, Coumadin. Lots of new drugs on the market nowadays can also do this job as well. But the word blood thinner is a misnomer. We are not truly thinning the blood. Instead, what we're doing is preventing coagulation from taking place. So people who take these drugs will bleed more freely and take longer to coagulate. All right, so just a great time to review what is required for blood clotting. That's calcium ions.